This medication helps to strengthen the body's natural defense system against infection in people with a weakened immune system. It contains natural substances called antibodies, specifically IgG, which come from healthy human blood. These antibodies help to protect the body against infections and assist in fighting off an infection if you become ill. In some cases, this medication may also be used to treat a certain nerve disorder known as chronic inflammatory demyelinating polyneuropathy, or CIDP. The recommended dosage and timing for taking this medication will depend on your specific condition and should be determined by your healthcare provider. It is important to follow their guidance for the best results. Before starting Xembify 4 g/20 ml, 20%. Subcutaneous solution immune globulin, gamma, IgG, make sure to read the patient information leaflet and instructions for use from your pharmacist. This medication is given slowly by injection under the skin as directed by your doctor. Your doctor will determine how often you should receive this medication, which can range from every day to once every 2 weeks. The dosage is based on your medical condition, weight, and response to treatment. If you are administering this medication yourself, it's important to learn all preparation and usage instructions from your healthcare professional. Be sure to check the product for any particles or discoloration before using it, and don't shake the medication. Change the location of the injection site with each dose to avoid problem areas under the skin, and the recommended sites for injection are the abdomen, thighs, upper arms, and hips. For those receiving immune globulin for the first time, switching from another brand, or who have not received it in the past 2 months, there is a risk of developing side effects such as fever, chills, nausea, vomiting, and rarely shock. It is recommended that these patients receive their first dose in the doctor's office or clinic to be monitored for these side effects. Using this medication regularly will provide the most benefit. Mark your calendar as a reminder of which days you should receive the medication. And consult your doctor or pharmacist with any questions or concerns. Some common side effects of Xembify include mild swelling, redness, or itching at the injection site, as well as headache, upset stomach, fever, nausea, diarrhea, sore throat, cough, or pain. These effects usually lessen as your body adjusts to the medication. However, if any of these effects persist or worsen, it's important to contact your doctor. It's important to remember that your doctor has prescribed this medication because they have determined that the benefit to you is greater than the risk of potential side effects. Many people using this medication do not experience serious side effects. If you experience any serious side effects, such as signs of kidney problems, sudden weight gain, or a fast heartbeat, it's important to notify your doctor immediately. Additionally, seek medical help right away if you experience severe headache, stiff neck, eye pain, sensitivity to light, or trouble breathing. While a serious allergic reaction to this drug is rare, it's important to seek medical help right away if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed here, be sure to contact your doctor or pharmacist for advice. This medication has the potential to cause serious blood clots, which could lead to conditions such as pulmonary embolism, stroke, heart attack, or deep vein thrombosis. Certain factors may increase your risk of developing blood clots, such as being an older adult, severe dehydration, having a catheter near your heart, a history of blood clots or heart/blood vessel disease, heart failure, stroke, or immobility. Estrogen-containing products may also increase your risk. It is important to discuss these risks with your doctor or pharmacist before starting this medication. If you experience any symptoms of blood clots, seek medical help immediately. It may be possible to reduce the risk of blood clots by infusing the medication more slowly or using a less concentrated form, if available. Ensuring that you are adequately hydrated before receiving the medication may also help reduce this risk. Before using Xembify, make sure to inform your doctor or pharmacist about any allergies you may have, as this product may contain inactive ingredients that could cause allergic reactions. Also, be sure to discuss your medical history, especially if you have certain immune system problems, kidney disease, diabetes, or if you have had recent or planned immunizations/vaccinations. If you have diabetes, it's important to check with your pharmacist if the product contains maltose, as this substance can cause false high blood sugar levels. It's also important to inform your doctor of any recent or planned immunizations/vaccinations, as this medication may affect your response to certain live viral vaccines. Since this medication is made from human blood, there is an extremely small chance that you may get infections from it, so it's important to consult your doctor or pharmacist for more information. And if you are pregnant or breastfeeding, be sure to discuss the risks and benefits with your doctor before using Xembify. Drug interactions can affect how your medications work and increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not make any changes to your medication without consulting your doctor first. It's also important to note that this medication may interfere with certain tests, potentially causing false results. Make sure to inform all lab personnel, doctors, and pharmacists that you are taking this medication, and specify the type of blood sugar testing strips you use. If someone has taken too much Xembify solution and experiences severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. It's important to note that Xembify should not be shared with others. Your doctor may also order lab or medical tests to monitor your progress, such as checking your IgG levels and complete blood count. Be sure to consult with your doctor for more details on these tests. Making sure to take each dose of Xembify as prescribed is crucial. If you happen to miss a dose, it's important to consult your doctor or pharmacist for a new dosing schedule. Avoid taking a double dose to make up for the missed one. When it comes to storing Xembify 4 grams/20 ml, 20%. Subcutaneous solution immune globulin, gamma, IgG, it's important to note that different brands of this medication have different storage needs. Be sure to check the product package for instructions on how to store your specific brand, or ask your pharmacist for guidance. Once you open a vial, it's crucial to discard any unused portion immediately and avoid freezing the medication. It's also important to keep all medications out of reach of children and pets. When it comes to disposing of this medication, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, make sure to properly discard the product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the proper disposal method. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.